Point, because I want to get to the voucher thing.
Sure.
You're saying that we're giving a voucher to people for Medicare. We're talking about premium support, which used to be an idea that Democrats championed, like John Breaux, Alice Rivlin, and others. This is not a voucher proposal where you get a check in the mail and then you take your money and you go buy something and good luck, you're on your own. No, this is a Medicare exchange where Medicare gives you, when you turn Medicare eligible, a list of guaranteed coverage options, just like Medicare Advantage works today, or like the Part D benefit works today. You pick your plan that you can't be denied, that Medicare pre-screens, just like federal employees do, and then Medicare subsidizes it. And here's the point I'm trying to make on the trickle-down point. We're saying don't subsidize the wealthy person as much. Target your spending, your taxpayer reallocated federal government spending to those who need it the most. More money for the poor, more money for the sick, less money for the wealthy. That, to me, is a far better way. Instead of spending more money on everybody in society, we should target our spending to the people who need it the most.
But Jared, what's your alternative plan? What's your alternative plan?
The alternative plan is the IPAB.
The alternative plan, thank you, exactly. The alternative plan is not cost shifting, actually like taking the cost burden and taking it from government or employers onto individuals, retirees. Good luck out there shopping for insurance with an inadequate voucher. It's cost savings, and the only way you do that is exactly as Mr. Ryan said, which is cost effectiveness through the Independent Payment Advisory Board, which has to get under the hood, look at how we're wasting money, which we do. In the private system, it's even worse than in Medicare, but we can agree on that, Representative. There's a lot of waste, and the only way you get
it's not worse in the private sector, though.
So let me get here.
It is. Private sector health care costs grow more quickly than public. I think Representative Ryan would corroborate that.
But the amount of fraud is much higher in Medicare.
No, I'm sorry. It's just that is a prejudice. But Becky, I can send you the numbers. Medicare has grown consistently more slowly than private, and Medicaid is even more.
60 Minutes did a huge report on the amount of fraud in Medicare and the amount that gets ripped off. If private companies actually spend a lot of time trying to cut that out.
If I send you some graphs later, maybe you can put them up.
Send them to me.
Jared does a good job. You do a good job of representing your side's point of view. And here's what the IPAD is, the Independent Payment Advisory Board. It's 15 people the president appoints to be in charge of Medicare financing, price controlling, designing new payment structures for Medicare. The lesson, I think, from the IPAD was that the 1997 law, which put price controls on providers, didn't really work. Providers were leaving Medicare, dropping benefits, so Congress passed 2 subsequent pieces of legislation trying to put the money back into the Medicare system because providers are leaving the system. So here's the lesson that we learned out of that. Price controls don't work on anything, but at least which is Medicare. What I think Jared's side of view is that, no, price controls, you have to get outside of the politicians. Price controls don't work because politicians lose their will. So this IPAD circumvents Congress, puts the recommendations in place without congressional consent. And if Congress doesn't like it, they have to replace the kinds of price controls somewhere else within the Medicare system of an equal amount.
I would never refer.
What I'm saying, if you don't mind, I try not to interview. What I'm saying is the difference here is we don't think Medicare or any healthcare system should be organized by a handful of unaccountable and unelected bureaucrats imposing price controls. We believe in patient-centered healthcare. We believe in a consumer-directed system. And we believe that this system should be one where we empower seniors to be good consumers with money, or all healthcare consumers. That means more for the poor, more for the sick, less for the wealthy, in a system where the nucleus of it is the healthcare, the patient, not some distant, unaccountable government.
Okay,
bureaucrat.
Jared, we're